All right, everybody, we're going to go ahead and get started. Couple housekeeping items. If you have a cell phone, if you can please turn it to silent for us. If you need to take a call, you are more than welcome to. Just please go ahead and use one of the exits here in the rear. And I'd like to welcome you guys to our February General Assembly. We've got some really exciting stuff that we've been working on for you guys, and we appreciate you taking the time to come out here and join us today. I'm going to introduce Angie Hoff. She is our MP and PA Services lead on our advisory board, and she is going to do our mission and vision moment. Maybe. There we go.
Okay. All right. Thank you, everyone. Welcome. All right. So the mission for LOCAH is Liaisons of Columbus Area Hospitals is a collaborative network of public and private agencies and individuals who are committed to excellence in coordinating the needs for the Columbus area population as they are transitioning from the hospital setting. Our vision is to educate, advocate, and elevate communication for Columbus area professionals to best match needs of those being served.
Thank you.
You're welcome.
All right, so we are going to jump in, and I'd like to thank Ohio Health and Marissa Campbell for hosting us here today. I just want to give you a little bit of background on Ohio Health. So they have 14 hospitals here in Ohio, one that they manage and 2 that they are affiliated with. So here in Columbus, the ones that we're primarily working with is Riverside Methodist Hospital, Grant Medical Center, Doctors Hospital, Dublin Methodist, the Ohio Health Rehabilitation Hospital, and they've got a large presence of primary care and other medical campuses throughout central Ohio. Wrong way.
This is advanced.
So some really interesting things to know about Ohio Health. They're a faith-based, non-for-profit healthcare system. They have 3.7 million outpatient visits, 572,465 emergency visits. They do 159,951 admissions and observations. So there's a lot of traffic coming in and out of these hospitals as they care for the central Ohio population. And a lot of those folks are the patients that you're caring for as they've had a change in condition and transition in or out of that hospital. Ohio Health, this was something that I found really interesting. I hope that you can see. I know there's a lot of details on this slide, but it talks about their journey. They began in 1890 as Protestant hospital, founded that is now known as Riverside Methodist in 1900, and that was in 1891. In 1900, Grant Hospital opened, and throughout the history up until today, you see other hospitals throughout Ohio joining the Ohio Health family, them continuing to develop significant services for the central Ohio population. And I was really impressed. I didn't realize how much of a presence that they have supporting Ohio as a whole with health and their population. We'd like to go ahead and introduce one of our sponsors here today, Laura Bliss, if you can come up and join us.
Thank you. I want to thank LOCAH for the opportunity to be one of the sponsors for lunch today, and Ohio Health for letting us meet in this beautiful setting. So thank you very much for that. I'm Laura Bliss. I'm one of the hospice liaisons for Suncrest Hospice. We expanded into Ohio in 2022. We have offices in Cleveland and Cincinnati, as well as the Columbus market. We have been providing great hospice care for over a decade and are currently in 12 states, getting ready to expand in Tennessee. So as many of you know, hospice services are a specialized form of medical care that seeks to provide comfort and maintain the quality of life to the best that we can for those that are facing life-limiting illnesses, disease, or a terminal condition. So the Suncrest difference, as we visit more. Our model is designed for our aides to visit up to 5 times a week and our nurses 2 times a week. We have highly qualified team. Some of you know a lot of our team that have been with hospice services and other companies for many, many years. So I felt very privileged to work with them. And as other hospice providers, we have bereavement support, yearly memorial services, emotional support, which could entail music or massage therapy. We give back. Our foundation allows our patients to check their bucket list. We're available 24 hours a day, 7 days a week, 365 days a year. And I know I'm in good company. There are so many wonderful healthcare professionals here that do amazing things. And I just want to thank you all for what you do. If you have any questions for me as far as Suncrest services, my email address is lbliss@suncrestcare.com, or feel free to speak to me after the meeting. And again, thank you and hope you enjoy your lunch.
Thank you. Then we have one additional sponsor. I'd like to welcome Jen Anderson from the Arbors at Carroll.
Hi, everybody. I'm Jen Anderson. I speak loud.
You want to be the best ones.
Oh.
So we have an online presence in addition.
So hello, everybody in person and online. I'm Jen Anderson. I'm with the Arbors at Carroll. We are one of 16 Arbors facilities in the Ohio area. For the Central Ohio area, there are 4 of us. Arbors at Carroll, what kind of sets us apart is we're right outside of Lancaster, so we're in the country a little bit, but we're still kind of in the city. It's very nice. It's a nice area. Some things that we do is we offer Medicaid pending admissions with no money due up front. A lot of people do money, you have to pay the first month, we'll reimburse you. What we do is we will help through that Medicaid process. We will do an asset check to make sure that Medicaid will be approved. If it looks like it will be approved, no money due up front, come on in. We're happy to have you. We'd love to have you. Janet is our business office manager. She is a whiz at getting that Medicaid approved, and we love Fairfield County. We are a smoker-friendly facility, so we don't see a lot of that. Now, granted, we would prefer people not smoke because it's probably not the healthiest thing for you, but that's your right. So we are smoker-friendly. We will allow people to smoke at our facility. We offer transportation to dialysis and doctor's appointments 6 days a week. We have a bus as long as it's wheelchair. Dialysis would be in the Lancaster area because we can't come up to Columbus, but we do offer dialysis transport. And I know our West location offers dialysis transport as well. We offer inpatient and outpatient physical, occupational, and speech therapy in our very large 1,700 square foot gym. And then we have 99 duly certified Medicare, Medicaid beds. And the insurances we cover, Medigold, Anthem, commercial. We can do one-time contracts with Anthem, Medicare, Humana, which I know Humana is not an easy person to find, but we do contract with Humana, and we do take CareSource. CareSource has been a challenge lately, but we do take CareSource. We do take Molina and our Medicare, Medicaid. If you guys have any questions, concerns, please come see me. I'd love to talk to you, set up a meeting, have fun. We're a great company, we're a great place to be. I know our Springfield facility does have a in-house vent and HD unit. Our West facility is a Huntington's palace. They really just take Huntington's disease and are run with that. And our Delaware facility is VA contracted and has a memory care unit. So any of our facilities, I'm sure we could find something for you. Thank you to LOCAH. Thank you for allowing me the time to come up here and speak to everybody and, dealing with my craziness, but it's fun.
Yeah.
And y'all have a wonderful day today.
Thank you. All right, so we're going to go just quickly through a timeline of key events through LOCAH's history. So LOCAH originally met and had a founding meeting in October of 2021, followed with us founding an advisory board and an executive board. In December of 2021, we had our first member resource center launched with a guide for Mount Carmel East. One of the significant challenges that us as professionals in the community face is when our patients are rehospitalized, being able to follow our patients, having that continuity of care, making sure that you are prepared for them to return to you and that there's not any significant challenges or changes. So we know that finding case management within the hospital system, that specific social worker or clinical case manager who's following your patient is a challenge. So we published our very first hospital guide. In February of 2022, we started to get our footing as an organization. We had significant member growth. We went ahead and were able to launch a revised version of our hospital guide featuring Mount Carmel St. Anne's and Mount Carmel Grove City. In June of 2022, we launched a website as well as a directory, really focusing on hosting resources that are going to help you as our members do your jobs in the day-to-day life. And at that time, it became really apparent that when we originally met, our organization was really focused on these providers here in the community. But it became apparent that it's not just a one-way street here. The hospital was having challenges in communication issues with us as providers. And so in August of 2022, we established a hospital board, welcoming Mount Carmel as our first member. And again, at that point, started seeing significant increases in membership. And with that came, significant challenges for us. We are, all volunteer-based organization, from our executive board to advisory board to everybody that has helped us out in our day-to-day. We are doing this, because we care about our patients. They're at the center of everything that we do. And we also, at that time, went ahead and just discussing how we can do a better job of managing such large growth. So we decided we wanted to go ahead and launch an orientation for members. One of the big grievances was I hear about all these resources. I don't know how to use them. So we began hosting on the very first Thursday of each month orientation for new members. And if you haven't participated in that and you don't know how to utilize our resources, we would highly encourage you to do so. There is information on our homepage on www.locah.org about attending the orientation. It's a Google Meet, not Teams, but just as fun. And at that time, we expanded our hospital board, welcoming Ohio Health with support from Marissa Campbell. And at that time, we also welcomed the support of Diane from Select Hospital as well. And then we have reunion with Courtney. So our hospital board grew significantly. And I think for those of you who are at our October meeting, we really at that point have a solid footing as an organization, being able to communicate with you changes and challenges and things that are happening in the industry to prepare you as you care for your patients. And then in December, we decided to host our first annual fundraising. We've been working on the resources, launching the website. There's a lot of tools and things that we utilize internally, and things come with a cost. And so for the first year and a half, we operated with no income. So we're really thankful for our members and the funds that you helped us raise at that meeting. And thank you so much for paying membership dues to help us do what we can for you guys as our members. And I think I'm going to turn it over to Nick.
Perfect. Okay, so that was kind of a recap of the last year that we have been together. And so now we wanted to kind of paint a picture for our roadmap for this coming year. We're really excited by the momentum that we're coming into 2023, and we've already kicked off and accomplished one of our first goals, and it's to publish our new 2023 membership guide. That's especially those that have been with us since the beginning. You've seen it come in different forms. There was password protected stuff before. There was all these different files. And so we really wanted to make this a seamless delivery for you so you can use this as a tool. So be on the lookout. We have finally got all of the Ohio Health ready to go with that information. So now we'll have an updated 2023 membership guide with all of Mount Carmel, Ohio State, and Ohio Health. So stay tuned for that.
We'll give you a sneak peek here, and there's 2 paper copies out in the lobby if you want to take a look. It's 50-something pages.
Andy's holding it. It's a thick book. So
It's a
maybe just keep it online on a nice file for you. Save the trees a little bit. But it's a lot of good information on there. And for those that are new to LOCAH, what the guides provide is kind of a resource for you navigating and trying to help your patients with that care coordination. So if you're not sure how to get a hold of this case manager, but you know your patient is in this room on this floor, there's a number for you to call for that number, for that room specifically, and to talk to that caseworker to help be a resource for them. And that way we can help be proactive in that care coordination, or if there's questions that are needed answered before they're discharged, things like that. So there's a lot of good information in there that is all in one place for all of us to use. The other big thing we have accomplished this year so far is having Ohio State participate in our hospital board. We'll talk a little bit more about that, but we're really excited to have Miss Lisa in the back. If you want to give a wave, we're really excited to have her part of this. And I think you've all since the beginning have known that this was, and as Michael talked about, that we thought we had it was the problem on our side. And then after talking with the different hospital systems, we've been able to hear that it really is, they have tons of barriers that they deal with day to day. And so how can we be this bridge? And that's where LOCAH was really formed. And that's what we're striving for, to be this bridge between the industries and the hospital system. So we're really excited to have Ohio State, and thanks so much, Lisa, for being here. Some other things are kind of our other goals we have for the year is expanding our committees. So we'll talk a little bit more about that in our committee update, but we've talked about that at the end of last year, but there's so many different things we want to do, and there's so many different avenues we could take LOCAH, and every day I feel like we think of something different. And so we definitely need help. So if that's something that you all are interested in doing, we have applications after the meeting that you can fill out, or you can let us know via email, and really enhancing those functions of what we're doing as a committee. Because our team that we have right now, they're rock stars, but like Michael said, we're all doing this in our spare time, which in healthcare, when do we ever have spare time? So, it's been a challenge juggling that. So we want to just continue with that forward. Enhancing the directory, our profiles. This is a big thing that is the main focal point that we're going to be working on this year. Michael's going to do a quick demo still. Mm-hmm. Cool. And what we're doing with the demo of our resource directory, that's what those surveys that we send out every month are for, is we're trying to collect and expand our resource directory so the hospital caseworkers and social workers have the most up-to-date information. And for us in the industry, if you're trying to work on a mutual patient together, using this directory as a tool for you to get in touch with the right people that can service your patient correctly. So we'll go a little bit deep diver into that in a little bit. Increasing our advisory board engagement with our industries is a big focal point for us too. This is our leads. When we started this, they are to be that representation for that industry. This is, Natalie with Collins and Cruz Law. Yes, she is our elder law lead, but there's numerous elder law attorneys that learn different tricks or know different strategies or have different opinions on things. And our goal for the lead seat within LOCAH is to be that representation of the whole industry. So I encourage you, if you don't have a relationship with the lead on LOCAH, or if your industry is not represented adequately within LOCAH, let us know. We want to expand it to a point where the further collaboration we can have, I think, is just ultimately going to be better for the patient. And then membership growth, obviously, Michael talked a little bit about that last year. We had 100 and... Okay, well, all right, we won't. But if you haven't applied, I think I saw a bunch of applications coming today. We really appreciate that. And hopefully the $30 membership fee is not a barrier for you or your company. And this is all going towards just continuing to work on what we're doing here as an organization. And then lastly, for just something to think about, Obviously, Michael and I probably won't do this for the rest of our lives. And yeah, any good organization has changeover and has change in leadership. And within the leads, for all the lead seats and the executive board, we're not going to do a full changeover. I don't know if anyone's read the bylaws, which, I mean, who reads bylaws, but we have a process in place for nominations to change over the board, because new ideas and new leadership is just only going to provide further growth for what this organization can become. So if that's something you're interested in doing, this is going to be towards like the fall, but I wanted to make a note of it, that that's something that this will be the first year we've had that, and for something for you to think about.
Yeah, so the terms in our bylaws is for somebody that applies to be a lead, the commitment is a 2-year term. And at the end of that 2-year term, you can decide if you would like to continue in that position. We will still take nominations for other folks who are interested in that position, and then we'll make a decision with the board meetings on how we proceed with that.
Yeah.
But yeah, so I think it'll probably be half of the microphone. My apologies. It'll probably be around half of our seats will be open for nominations, and it'll alternate years so that there's not significant changeover on 1 year inhibiting us to operate as an organization.
I think that's kind of the, like, concludes kind of our roadmap of 2023, what we're really focused on as an organization. Obviously things can change, but those are kind of our main pillars that we're going to be working towards each year, and so, or each month. And so, you know, if you want to be a part of that, I think being a part of the committees is a great way to be involved with this organization. So look for more information on that.
All right, so we're going to go into some items from hospital board. So we already announced Lisa. She's the Senior Director of Integrated Care Management and Quality for the OSU James Wexner Medical Center for the James Cancer Hospital. And we also have Dana with us from Reunion. Welcome up to give us an announcement.
Hello, everyone. I don't know if you can hear me. Sorry. I don't even know if you can see me, but my name is Dana. I'm the Director of Business Development for Reunion Rehab. I just wanted to announce that we have officially, the announcement had come out that Reunion will also be joining Ohio Health. So we will be their second joint venture. That will take place on March 28th. Until then, for Reunion, business is as normal. For Ohio Health, business as normal. We will continue to take patients up until the acquisition takes place, which is March 27th at midnight. So once that happens, we will now be Ohio Health of Dublin Rehab. That's what our sign will say. I wish I had more details to give you guys, but unfortunately, we don't even have many details that we can share to you because everything is pretty quiet until the acquisition takes place. But once that happens, we can definitely reach out to our hospitals, our vendors, and just let you know how that process is going to work, because there will be a change in process. But just so that you are aware, the staff inside Reunion will remain the same, as well as the staff inside Ohio Health. I think the main thing is just our process is going to be a little bit different. But I just wanted to let you know that Reunion will operate up until that time. We'll still continue to take patients. We'll still continue to work with our vendors and our hospitals as normal. So that will not change.
All right, thank you.
Thank you.
Thanks, Dan. And I wanted to dig into some of the pressure points that the hospitals have been feeling and that we've been discussing again and again. And we're discussing it because there's still significant challenges. One of the issues is guardianship. In the Columbus area, there's quite a few folks who don't do planning for that day if you ever become incapacitated, whether it's because something significant happens, like a car accident, whether it's something like dementia or neurocognitive decline. If you lose the capacity to make decisions for yourself and you don't have a financial power of attorney in place and healthcare power of attorney in place, you can end up hospitalized for months while they go through probate court, dealing with assigning you a guardian and vetting your need to have somebody make decisions for you. So we are asking you as members of our organization, your organizations do a lot of community outreach. You do lunch and learns. You do a significant amount of education for the community. We want you to partner with those who can help you provide that education so that those in the community, as well as those that you're caring for, have those in place. That way that they are able to avoid that significant challenge, that they're not stuck hospitalized and they're not stuck having somebody else make decisions for them. I will have Jackie just stand up for us and Natalie real quick. So they are with Collins and Crew Law Office. They are happy to partner with you guys. We also have other practices within LOCAH. If you would like to have a partner to do Medicaid or financial power of attorney education, those are some great resources. Thank you guys. Connect with them after the meeting. Look for Natalie in our resource directory and make that connection. The next big challenge, home health care. Who do we have from home health in the room today? Handful of you guys. One of the big challenges that hospitals are facing right now is patients who require wound care and being able to discharge them home with home health care, because there's a variety of reasons, visit frequency, payer challenges. We sent out a survey this month that asked you extensive questions about wound care and that situation and what you can and can't manage. We are trying to put something together that is useful to case management when they're trying to send somebody home that has wound care needs, that they can get a provider to do that for them. We want to have folks go to the appropriate level of care. We all love our nursing facilities, but sometimes it's not the most appropriate setting for a patient. And if they go home, if they can go home, that's where they should be. Another big pressure point is responsiveness in Epic. We get busy in our day-to-day lives. We get tons of referrals. It could be a challenge to manage that high activity. But the hospitals are feeling that pressure where they're sending referrals, sending communication, and having extended periods without any response, holding up the discharge planning process and putting them under pressure when it comes to hospital census and case or resource management. So we'd encourage you in your organizations to look at your responsive times and see if there's any opportunity for some process change and improvement there. I think we go to the next slide. We do.
Alrighty, so some advisory board updates. The big thing on our SNF side is the end of public health emergency. That's going to be on May 11th. Is that correct? May 11th? I think it's May 11th. And that'll be the 3-day waiver is ending for the hospital. So before COVID, they had to be admitted for 3 nights before they would qualify for a SNF stay. So that's ending. So I'm sure that'll be, and then I think there's some impact too for, direct admit from home as well. So they're going to need that 3-night stay. So we'll keep up to date once, we'll have our April meeting. And so if there's any changes to that and just some further details with it, but wanted to make everyone aware of that change. So some of the other pressure points that we have heard is that the hospitals, we're having patients discharge with still having an e-sitter, and there's no documentation of that. So one of the kind of the best practices that we're encouraging is just making sure that's a communication between you and that case manager, because even though it's not documented, and I don't know if the legality of that, I think we're still looking into that and talking with the hospital systems with that. But that's obviously something we want to make sure that there is a safe discharge. And if there's a discharge while there's still an e-sitter, then maybe this isn't the appropriate placement for them. And we didn't have all that information. So I would, we're encouraging you to do that due diligence to make sure with that case manager that's being discussed. And then we're still having the errors or consistencies within the AVSs. That's something that the hospital is aware of. They're working on trying to make sure that all that information is needed. So if you have that instance where, hey, we had a patient come now that's missing, and the updated medication list, or there was not wound care sent with them, or whatever the specific instructions that were missing, let us know that, because we have that's where we can be that bridge to discuss that with the hospital boards. So, and to
I'm gonna
kind
jump in.
of jumped on that, yeah.
So in the hospital guide, there is contacts for the area hospitals. And they want you to reach out to them specifically. So if you've got a patient coming from Mount Carmel, Jennifer wants you to call her, to call one of the directors of the building, to call a lead. They can't correct that challenge without those specific details. Who was the patient? When did it happen? What was the inconsistency? What was missing? Otherwise, we're going to continue to have those challenges. So in the hospital guide, it's got contact information for Ohio Health as well. And I think that for OSU East, we've got leadership contact, but for Medical Center, I would have reached out to the case manager who you worked with directly. And maybe we'll have more information to come as we work with Lisa and the rest of the OSU team to work on that challenge.
You can't fix if you don't know it's a problem. So if there's issues that you're noticing with that discharge from the hospital to and from, let us know that, reach out to, we want to continue to, and if you're not sure who to reach out to, let us know and we can help you with that. So, and then the last part, I know just because I know Margaret with Synchrony, and this is something that she's kind of touched on, or she's kind of working through, is that like discharging medications from the hospital, or patients discharging from the hospital without their pain medication, and just that delay in receiving that. Obviously, it's a big pressure point at the hospital. The patients are unhappy, they're in pain. So that's something you're dealing with that, especially on the SNF side. If you're dealing with that problem as well, that's something the hospital is pushing us to kind of work on. So
The challenge, I want to be in front of the mic, I'm sorry.
you gotta make sure you're heard.
A big challenge is, the time of discharge. When you look at when physicians do rounding, by time transport is available for that patient, transportation is one of the big bottlenecks when it comes to patients getting into your care at a time where you can get those medications. We know that, there's Pyxists and, the emergency pull box, but they don't always have every medication. If you have a lot of options, you can run out of the, narcotics and different things in those boxes. So it's a real challenge with that discharge time too. So here in Central Ohio, transportation, who hasn't had, issues with transportation?
Right.
Yeah, everybody. It's a huge issue. So we're continuing to look and see what can be done or how we can help that issue.
And then just some other coming up changes we're still working through. There's new regs published by CMS for SNFs. So there's going to be updates from that. There's some changes going with Medicaid being auto approved. I don't know if we've gotten really further information on that, but I know it's something that is coming.
So for the auto, so with the pandemic, folks who applied for Medicaid, they didn't go through the eligibility vetting process. A lot of folks were automatically approved for that benefit. Starting on April 1st, the Ohio Department of Medicaid will be looking at their enrollment, verifying those folks still are eligible from an income standpoint and their other criteria. So for you guys as providers, you might have folks who get dropped from Medicaid, so you might have no payer issues. So make sure that you're utilizing Ohio's MITS online portal after April 1st, verifying, and I would encourage you to check for the first few following months to make sure that folks still have those benefits. And if there's documentation or different things that they require, you're going to want your business office teams to be on it so that there's not any gap in care for those patients.
Do you want to talk on the parachute?
Sure. One of the things that one of our members gave to us that was a significant impact was a referral platform called Parachute. I'm not familiar with Parachute. Is anybody here in the room familiar with Parachute? Do you want to pop up here and give us a quick rundown?
Yeah.
Come on up here. So they said that it's a tool that was making a significant impact when it came to the DME and the respiratory supplies and what have you. So
I wasn't prepared for this, Michael.
I know, I thought that was fun.
I was like, oh, okay.
This is Margaret Gibson. She's with Synchrony.
Yeah, nice to meet everyone and see some familiar faces. So we used Parachute in my past life with home health, where our DME coordinator would essentially use this online portal to order DME to include DME supplies, walkers, wheelchairs, hospital beds, even oxygen. And it actually interfaces with multiple DME providers. So not just necessarily one DME provider. So it was a great way. There was two-way communication with a DME provider, and the portal access could be accessed by remote. So you could actually, if you service an area that is outside of Central Ohio, that also serves, multiple states, the state of Ohio, you have the same online access. So it really seemed to expedite and improve the communication and delivery of DME, which seems to be a major issue. So it's a great way to streamline that. So,
Thank you.
all right.
And we also had some changes when it comes to Medicare guidelines when it comes to being able to bill for things. So if there's providers in your community, you're going to want to make sure that they're aware of that. And I don't know all the details of it, but that's one of the things that was a significant change that we wanted to share with you guys. And then last but not least for big changes. So we talked about in our October meeting that the Ohio Department of Health was now regulating private duty home care. And that process is underway and it's seeing significant bottleneck. So for the providers that have applied, they've had over 900 applicants. And it's taking on average 10 weeks to get approved. So if you've got folks that are in that situation, just know that it's due to them having 3 employees. So
One thing we wanted to ask during this piece is, does anyone in here have any news regarding to your industry that we haven't touched on? And if you don't feel comfortable sharing, that's fine. That's what this organization is for. That's what our leads are for. And to be this bridge of knowledge for each other, because the more we know, the better we can help our patients. So I don't know if anyone has anything they want to stand up and share really quick.
Piggyback on.
Yeah, sure.
So, I'm Brooke, I'm the lead for private duty. So the last point there about the application, there are tons of long-term care insurance providers that are refusing to reimburse the families once the submissions of invoices are being paid, because we've never been a regulated state for private duty. And now all of a sudden they're asking us to jump through these hoops. So make sure, just as I've been doing this every day, just make sure that you ask your client patient to review their policy with their provider if there are issues, because there are loopholes where home health can come in with PT and they'll give a per diem benefit. So there are loopholes, so don't get discouraged. But if you need any help or any additional information,
Thanks, Brooke. Yeah. Cool. All right. We will, I guess one last thing on this, and I kind of already touched on it a little bit, but if you do not have that relationship with our lead, please schedule a copy with them. I'm going to tell them to book up their calendar with it, because we need that communication with each other. I mean, the biggest thing, the best way to do that is to have that, relationship with each other. And yeah, do you mind all of us just standing up? That'd be great. So Brooke is our private duty lead. Patrick over here is our independent and assisted living lead. Joette, Dr. Greenstein, is our hospice lead. Angie is our NP and PA lead. Ann Farley back there is our memory care lead. And Ashley is our home health lead. Natalie is our elder law lead. And Olivia is our SNF lead. That's kind of our board. Awesome. Want to do the next part?
yeah. I didn't talk enough on this slide.
No.
All right, so some committee updates. So in 2022, we hit 178 members. So really proud to be engaging with a huge chunk of the Central Ohio healthcare population. Every year, we are now renewing memberships. So you refill out that application, it allows us to reconcile things. So as of yesterday, we had 55 folks who had renewed that. If you have not renewed it at this time, or you are a new member, after the meeting, there's computers out here with things set up for you to apply. Orientation committee, just wanted to hit. So the past couple months, we haven't had significant participation in that. We really want to make sure that you guys know how to utilize the resources that we have. So just to make a point that that's at 12 p.m. at the first Thursday of every month. It's hosted on Google Meets. You can see LOCAH.org for more information. If you guys have tried to go to LOCAH.org since like 11 o'clock last night, it's not loading. I accidentally broke the website last night trying to add something to it. So we will send out some communication to folks on our mailing list. When that is back up, we do have an alternative workaround to access the website. So I will send that information out to you guys. And the committees. So it's anticipated for when we expand the committees, the obligation, the time obligation for those who are interested in participating in either the membership committee or the technology committee or events, that if you do so, that's looking about to be about 5 to 6 hours per month, with us just having one meeting. Some of them will be virtual, some of them will be in person. We would love to have your participation. The applications, again, are out in the lobby for that.
And one thing on that is, if, as we talked about with at the end of the year, having, people take in some of the leadership role within the organization, this is going to be a great kind of stepping stone, get your feet wet a little bit with how LOCAH is operating, how it works with the hospital systems, and just kind of the different systems in place. Because these meetings, yes, they're nice to see everybody, and this is kind of what we're giving our updates as an organization. But being involved in the committees is really the best way to get your feet wet and to help and make that impact.
If you're interested in a lead position in the future, yeah, you'll get to see how we operate, and that'll tell you if we're the right fit for you when it comes to volunteering. I'm going to do a couple things. I'm going to go over the directory here real quick with an example of a highlight that we're looking to do. So I'm going to go ahead and see if I can do that. Okay, so this is our website if you are familiar with it. And to access the directory, there's a resource library tab on the left-hand side.
I get full screen.
Oh, just kidding. It's on the wrong screen. My bad. Thank you. All right, so this is our website. It has the resource directory, and there is a link on there to our contacts, essentially. This is also something that you can access directly by going to contacts.google.com and logging in with the credentials that are provided to you in our membership guide. So right now we've got 337 contacts loaded into this system. We've gone over it in the past that it's got, SNFs, hospice, acute care hospitals, so on and so forth. You can see the different categories of things that are loaded here. On the left-hand side, we are working to enhance the searchable criteria. And right now, one of our focuses is on the home health. So say that you are looking for home health care. You hit a search button and it's going to not work. Oh, I need to type it. So home health care, you search it, it's going to give you a list of providers. It's giving you specific people who work for home care companies, and they're, oh, I'm doing it on the wrong computer. I'm sorry. So when you search here, search home health care, and
That way. Can you do it from there?
I can do it from there.
Yes, that's crazy.
Okay. All right. So you search home health care, it's going to show you a list here of the folks from home health that are loaded into our database. And we want to add different things like insurance to it. So let's add Aetna.
Like, I can't do that at all.
I can see a little bit. So you search Aetna, it's going to show you that Enliven Home Health, they've got a contract with Aetna. It's going to allow you to search different clinical needs. So in our survey, there is different boxes you could check for the services that you do. So let's put ostomy. Maybe if I can see. Again, they come up. So when you have these profiles here, they are loaded with the specific needs that you're able to manage. And we're not trying to put everything under the sun into this. We're trying to put things into this that are challenging. Not everybody does. That could be challenges when it comes to discharging. We also in this month have a sniff survey out, and there's extensive questions there. You know, will you consider somebody that's on Suboxone for pain? Will you consider somebody that's on it for addiction? So on and so forth. You'll be able to plug those kind of questions and criteria into this search bar to see providers who can manage those needs. So if you haven't completed a survey for the month of February, we ask you to do so at the end of our meeting. It was sent out via email. We can send it out again here. If you aren't getting our emails, we'll send that out here today so that you can check, see if it's in your inbox. If it's not, check your junk.
And one kind of note on that is I know we're working with Jennifer to have a time to schedule with Mount Carmel. And I hope this is something we can talk about too with the other hospital case managers, but to show and to teach them and do a tutorial of how to use the resource library. So it is
and we
vital.
do it in
to have.
orientation.
Yeah.
We do it in orientation. We don't dig into all the different search criteria. You can see on the left-hand side, there's criteria loaded. When it comes to the different industries, what we'll probably do is a tips sheet that shows you the searchable criteria for home health, the searchable criteria for SNPs, and so on and so forth. So it makes it easier when you're looking for those difficult needs, finding providers. When it comes to these surveys, as our membership grows, we're going to have some standing surveys that we will build into the website. So if a new SNP company opens, there'll be a section on the website. They can submit that form. It'll send us an email with that updated criteria so we can update it here in the directory. We'll hopefully be able to turn some of these things and not to just this form that you see in front of you electronically, but maybe in the future incorporating some of it into our guide way. And if you don't know how to access this, it's included in orientation. It's included in the membership guide. It's available on your desktop, and it's also available on your phone. The next thing I wanted to show you was, I don't remember because I have to look at my slides. Oh, the Ask LOCAH. So if you guys are familiar, we have a group email, ask.columbus@locah.org. We enroll our members into that group email at the time that they sign up for an application. And essentially, it is an email that our members or anybody from the area hospitals can send an email to us. A couple of them have gone out in the past couple of weeks. We had a hospital that was trying to find placement locally for somebody who was a tier 2 sex offender. We've had folks that needed certain insurances. There's been a couple emails that folks have sent out asking for needs. Know that's a resource that's available to you and available to case management to try to close that gap if they're having a hard time finding somebody to meet those needs. And then
Be sure to switch it back.
I think that's everything that we were going to go over here.
Yeah, just do wrap up.
There is I did want to hit on this. So if you have an iPhone, I'm really tech savvy with iPhones, and have some tips here for if you'd like to set a shortcut on your phone up. You go to contacts.google.com and you log in with the credentials that we provide you. You can tap to add to your home screen, and it'll add a little icon there that you see the Google contacts. You can rename it however you see fit, and it will stay logged in. So you don't have to always re-log in, and it's available there on your phone. So you can search for these kind of needs while you're on the go. That way you don't have to pull out your computer. So that's something that is available to you guys as well. Yeah, so if you go to contacts.google.com on your phone, there's a login screen here. It's the member@loca.org. The password to log in is provided in the guide that is hosted on our website. Actually, I will show you where to find that as well. So on loca.com, in the resource library page, scroll down, and on here, there's the generic search Medicare Compare, which is a great resource. And then there's the Google Drive that's embedded. And in the Google Drive is a bunch of different resources. And one of them is the PDF file for our membership guide. Tell me, am I hovering over it? Up one? Okay. So you will not see that folder unless you've logged in to the member account. So let's open that up. Okay, so this is the most recent hospital guide. This is the best way to access it. You are welcome to save it locally on your device. We ask that you do not email this out. We are trying to make it easy for you guys as members. We don't want these materials to be abused. So please don't publish this somewhere else publicly. Use it as a resource that we've put together for you, and make yourself familiar with it. Well, I'm trying to wrap up for you. I'm doing a very poor job of it. There we go. And technology is great and terrible all at the same time. All right.
All right, so just to wrap up a couple things, in the back, I think most everyone that had time to come when they were coming in, check their membership. But if you haven't applied, please do so. And if you think you have applied, we said you didn't, then just talk to us afterwards. Once again, it's just that $30 membership fee, and then you can have access to that membership, to the guides and all the other information that we've been talking about today. Our next General Assembly is on April 13th. It's from 2 months. It's always the second Thursday of every month, or of every other month. And it is at the Siegel Center near Mount Carmel East. So the website on there, or the address is on our website and on some of the flyers that you've seen. And then if you're not getting our emails, I know this is something even members from last year, it's been, technology, we love it and we hate it. And that's something we're trying to be diligent about, having that communication with you all. So if you haven't been getting the emails, please add your name or your contact information to the membership list, the email list, or just let us know. So send us an email and we can make sure you're on there. And then just another survey reminder, as we've really talked about why it's so important that we're doing those, and how we're continuing to work and build our directory. This is another big reminder. We send those out. We're trying to come up with different ways of how to engage and make sure we're getting those responses. And so if you have any thoughts or feedback on, maybe advice on how to get more people to do the survey, that would be awesome. And so if you can just make that kind of a diligent plan. I know we have so many different things going on during the day. And it's easy to forget emails, especially if you open it up and I'm not getting back to it. So just come up with a way so you can make sure we're completing those each month. Anything else?
That's it.
That's it. Thanks all for being here.
We've got about 20 minutes, so feel free to hang around, communicate with each other, connect, and have a great rest of your day.
What kind of?
How do I stop it?
I think you hit this end button.
Yeah, but I have to stop it on here.
The pause. Oh, on here. There, I don't know how you were even doing that.
I'm doing all right. How are you? Give me 2 seconds to. Stop sharing. Check the chat. Okay,